Thank you, Simon, for the question on Tigray and Greater Horn of Africa. And the situation in Tigray clearly is still very, very difficult. We are talking about a blockade for more than 2 years, and still access to fuel for humanitarian workers is a big challenge. Humanitarian actors need 2 million liters a month, and since April 1st, they have received less than 2 million liters. So, and the supply of medicine is still very challenging for WHO and partners. We have big delays because of the permit authorization to supply, in Tigray. And if you look at the level of disruption and lack of access to health services where health workers were not paid, it will take months and months for the system to recover. In the meantime, we have already lost so many people, so the recovery will take very, very long. And we are not even yet filling all the needs, even to talk about recovery, making sure that we have full access and delivery of supply is permitted without any restriction will be extremely important. And if you look at functionality of health services in reporting, we have seen now around 50% of the health facility reporting, meaning that even to be able to detect and respond to outbreak is very limited. The situation is, has been exacerbated by the situation in the Greater Horn of Africa. Today we are talking about more than 20 million people in Ethiopia that need support for humanitarian, needs. If you look at the Horn of Africa, the total population is close to 200 million, but we already have 80 million people in a very acute food insecurity situation. And when you talk about food crisis, we are already in a health crisis because of the many reasons already explained by Dr. Tedros in the opening. So we have seen so many outbreaks of cholera, measles, malaria, meningitis in so many countries. In addition to that, the lack of access to primary health care because of the number of internally displaced population. We are talking about 11 million population now displaced on 4.2 million refugees. So, and WHO is looking for $124 million to cover the health needs. So far, we are only covering 12% of the need, and mainly from the WHO contingency fund for emergencies. Thanks to our partners for the support, but we need much more in a bigger scale and very rapidly if you don't want to lose millions of children and millions of population. Thank you.